In December 2019, coronavirus disease 2019 or the COVID-19 was identified in Wuhan, Hubei province, China. The disease is associated with a novel coronavirus, which is the seventh coronavirus known to infect humans. As the COVID-19 pandemic disrupts and brings significant stress to everyone's day-to-day lives, it may also exacerbate existing mental health conditions among students. Mental health issues are the leading barriers to academic success. Mental illness can affect students' concentration, motivation, and social interaction, important factors for students to succeed in higher education. College students are facing a variety of challenges in the wake of the COVID-19 outbreaks. The pandemic has been escalating and threatening the welfare of human beings globally. And this public health emergency generates fear and leads to a spectrum of psychological consequences ranging from distress responses such as anxiety, depression, and substance abuse to behavioral changes such as difficult sleeping and stress eating. The COVID-19 pandemic has brought into focus the mental health of virus-affected population. It is known the new stressor, including worries and fear for themselves and loved ones. Control physical movements and social activities due to quarantine protocol and sudden radical lifestyle changes. A recent review of coronavirus or the virus outbreaks and pandemics documented frustration, boredom, inadequate supplies, infection fear, inadequate information, financial loss, and stigma. There is a shared obscure evidence that pandemics affect the psychological or mental health of college students who are vulnerable known in population. Although finding from this study converges on mental health issues among college students, contributing factors may not necessarily be generalizable to the population of other countries. As highlighted in multiple recent correspondence, there is an urgent need to assess the effects of the current pandemic on the mental health well-being of college students.
So, in background of the study, it highlights students' mental health, especially in higher education, stress and other mental health issues related to this study. Since COVID-19 became more rampant, it brought the students into renewed focus. The rising concerns about mental health problems among students. As highlighted in multiple studies, there is an urgent need to assess the effects of the current pandemic on the mental issues and well-being of college students. It also highlights to encourage students with mental health problems to seek professional help, just like mental health counseling. A youth mental health advocacy organization lead a campus program to improve mental health resources.
In line with the social isolation effort to help flatten the COVID-19 curve, colleges across the nation have closed their campuses and dormitories. Some students have returned to abusive households, others to an empty fridge, and others to no home at all. It is well studied that college students are especially prone to feelings of loneliness. It is normal during this crazy time to experience feelings of sadness, anger, frustration, anxiety, or all of the above. Know that it is okay to feel how you are feeling. Maintain a routine, set a goal for coursework to be completed for each morning and afternoon. Maintain a consistent sleep schedule. Limit screen time in evening and avoid caffeine starting in the afternoon. Stay socially connected by engaging in regular video or phone calls with friends and family. especially take time for yourself each day. Mental health counseling has remained on the margins of a youth mental health advocacy and suicide prevention organization leads a campus program to improve mental health resources. Even as some mental health reports signal troubling trends, other experts believe the problem may not be as bad it seems. To eliminate or at least lessen the effect of COVID-19 on mental health, we need to do the following, like talk about your feelings to others, to your family or friends. Spend time doing things you enjoy and find relaxing like watching movies or playing video games. Try to get going and keep doing things like physical activity and creative play. For example, drawing, singing, or dancing. Have enough rest and sleep. Eat healthy foods. And learn and practice meditation. Also have quality time and home like your family. That's all.
Due to COVID-19 pandemic, students experiencing anxiety, depression, and stress due to long-lasting lockdown and stay-at-home mandates. It gives a negative effect on higher education and learnings of our college students to achieve their goals. This study will highlight the urgent needs preventive strategies to address and mental health of college students.
This study indicates that the COVID-19 has a major impact on the mental health of students. The education system has changed because we have this distance learning and the daily activity of the students is also affected. Unlike before, that we students tend to go to school to attend class and can hang out with friends. But today is different because the government implements lockdowns. That's why students tend to stay at home and attend class there. And it makes students safe for not getting the illness.
In this issue paper, our findings indicated that the COVID-19 outbreak has made significant impact to the mental health, education, and daily routine of students. Due to the situation of COVID-19, many students are likely to suffer from stress, anxiety, and depression. So it is necessary to provide emotional support to students. The association of different stress busters on the mental health of the students through anticipating the needs of the vulnerable student. Improving healthcare management would ensure the delivery of mental health support, especially college students who still try to adapt the new normal education.
The COVID-19 catastrophe has a significant impact on higher education due to the long-term epidemic's condition and respective interventions such as quarantine and stay-at-home orders. Our results illustrate the critical need to implement approaches and prevention measures to address college students' mental health. Along with primary care facilities and assumed food sources, government and private organizations and healthcare agencies offer psychosocial and mental health programs. Furthermore, as part of the COVID-19 disease reduction and mitigation initiative, the government should provide mental well-being and psychiatric interventions.
Moreover, amidst this COVID-19 pandemic, we can carry the different battles in our minds. It's not easy and there aren't easy solutions. But we must remember that we are much stronger than we realize to overcome such things in our lives, and likewise, we shall also get through this soon. In light of the aforementioned projections have continued COVID-19 cases, there is a need for immediate attention for everybody and support for students and especially other vulnerable groups who have mental issues. It is essential to assess the population's stress levels and psychosocial adjustment to plan for necessary support and necessary support mechanisms and especially during the recovery phase as well as for similar events in the near future.
COVID-19 is a disease associated with a novel coronavirus that was identified in Wuhan, China on December 2019. It controlled physical movements and social activities due to quarantine protocol and a sudden radical lifestyle changes. Also, it can affect our mental health, especially students, because it affects their concentration, motivation, and social interaction that are the important factors to succeed in higher education. With this problem, researchers and experts come up to a solution to eliminate or at least minimize the effect of COVID-19 in terms of mental health of students. Some of which are have enough sleep and rest, talk about your feelings to others, doing things you enjoy and find relaxing, and have quality time for your family.
During this difficult time, it is important to continue looking after your physical and mental health. This will not only help you into long term, but also will help you fight COVID-19. Eating a healthy and nutritious diet which helps your immune system to function properly. Limit your alcohol consumption and avoid sugary drink. Don't smoke. Smoking can increase your risk of developing severe diseases if you become infected with COVID-19 and make an exercise habit.